Well, hi, welcome to Habitual Excellence. I'm Mark Graban, and very pleased to be joined today by Dr. Daniel Carey. He's the Secretary of Health and Human Resources for the Commonwealth of Virginia. Secretary Carey, how are you?
I'm doing great. Thanks for having me here today.
Well, sure, and thank you for being here and taking some time to share some lessons and reflections with us. And so first, I was wondering if you could touch on your time as a physician and a physician leader. What did you learn about the lean methodology working within a health system?
Well, I would say that I was exposed early on. I am a or was an interventional cardiologist, and I had a tour of duty in the United States Air Force. And when I was the medical director of the cath lab back in the early to mid 90s, aviation safety and that concept of high reliability, although I don't think those terms were necessarily used, those concepts were, in the firmament. And looking at how to systematize, how to decrease unnecessary variation, and how to improve the quality of outcomes for patients and for staff was very much part of it. Mm-hmm. And then when I went into the community back in the late 90s, we continued that. And I think some of our effort was really around the treatment of acute myocardial infarction, looking at what was called the door to device, the door of the hospital and the door of the cath lab to the time that you would get a balloon or some type of treatment device at the point of care, really where down in the patient's artery that was suffering a heart attack. So we started to keep track of numbers and whose watch was it? Was it the ED doctor's watch, or was it the watch in the room, or was it the time on the timestamp on the ECG? So that was my initial experience, and that was my big, I would say, extracurricular activity beyond patient care, was improving the treatment of patients in myocardial infarction. Mm-hmm. And then as I think safety culture really became more recognized nationally and internationally, we really acquired the language and started to use that to flatten the relationships, to make sure that every team member felt safe to speak up. And Mark, a good example of that I can remember so clearly was in the cath lab, where we had tried to create that much more flat social structure and hierarchy to eliminate as much hierarchy as possible. And I remember it was a busy day, like most days are, and I knew we had made a difference and changed the culture when I had asked for a particular piece of equipment. And without hesitation, the technologist said, "Hey, Dan," and we did move to using first names. "Dan, I think you want this piece of equipment, a balloon, not a stent." And one, she was professional and knew the steps and knew what I was thinking, but and knew that what I said was not what I wanted. And that was just a great example where she just, without hesitation, said, "Hey, Dan, I think you need this, or you want this, right?" And it was an example where in previous times that at that an expensive piece of equipment would have been opened, and I would say, "Darn, I made a," if I said, "Darn, I made a mistake," we'd already opened it. And this is a good example of the success of trying to change the communication and social structure such that there was much more open communication. Everyone is respected. Everyone is expected to speak up, and that leads to better outcomes. And that is a small little outcome, but they're also, with 6 other operators, I think that spread throughout the cath lab, and I think that was part of an important growth for that unit.
Yeah, well, that's a great story, great example of that culture change.
And Mark, I think my work with lean methodology grew further as I grew in my leadership roles. And at Centra Health in Lynchburg, I was asked to lead implementation of a lean management system. So just not the tools at the unit level, but a whole system of leadership and development, so that how leaders led and how leaders communicated, both with other leaders at different levels, but also with frontline staff, changed. So it's been a 25 to 30-year journey for me, and I know I'm learning every day. I still have a lot to learn.
Well, sure, we all do, and it's good to recognize that, right? So I'm sure the learning has continued, accelerated in your time as Secretary of Health and Human Resources. So I'm curious, maybe in the context of what you've learned and also what you've done. You've done a lot of work to bring multiple agencies together, working on Medicaid expansion. I was wondering if you could talk about what you've done there, how you've approached that, and what you've learned.
Sure, and I'll focus on Medicaid expansion. That was there was the negotiation and the political side between the governor and the General Assembly back in 2018, a little over 2 years ago, or coming up on 3 years ago, really. And then there was the implementation. So how to get all of the different agencies. It was social services that did eligibility, but it was the Medicaid agency, DMAS, the Department of Medical Assistance Services in Virginia, that has the systems that actually contracts with the provider groups and the MCOs. But VITA, the IT agency for Virginia, and communications, and all of those agencies beyond one secretariat needed to work together. And I will say that steering committee that came together, met every 2 weeks with work groups working in between, was critically important. And I think what made it part of a lean mindset was that creating that psychological safety. This was highly complex. It was passed through a bipartisan effort, but still there was a partisan aspect to it in terms of it was closely negotiated. So its success was critically important, and everything had to really go well. So creating that psychological safety. Hey, I'm having a problem here with this issue. I need some help. And I think that the making it safe to say there's a problem, making it safe to say, hey, we need to stop until we solve this problem. And there were several instances of that were critically important. And then making sure that leaders were there to support that. And it was a sign of strength, not a sign of weakness, to say you had a problem, to say you needed help, to say that there was something unexpected happening. So I think that was a cultural aspect of the Medicaid expansion steering committee. And it was also with the political appointees here in the governor's office that were all a part of that process. And I think, today we have almost 460,000 Virginians covered through Medicaid expansion. And that was really and it went, I won't say flawlessly, but without the major glitches. And I think that lean mindset was very much a part of that success. And then I would say, secondly, that here in the era of COVID-19, as we're still very much in the midst of the response of the pandemic here in Virginia, that having that mindset of what does this mean for the front line? What are we hearing from the frontline workers when it comes to the need for personal protective equipment, or the need for testing, or how to integrate childcare into their being able to get to work for essential workers, whether they're in the private or the public sector. I do think once you've been in an organization like I had the great pleasure of being in my past health system, you're used to the results and benefits that come from making sure that you can hear from the front line, that you have, again, it's a different way of thinking once you kind of cross that threshold to say, hey, the people who know how to solve these problems best and probably know the characteristics of the problem are right there, in that environment, serving the customer, the patient, the resident of Virginia every day. And I think that has carried through how we've approached this. So it really, pandemics and emergency situations, often bring out your best, or they certainly reveal who you are. And I think that really has revealed who we're trying to be here in Virginia.
Well, there's a lot of lean principles and concepts and practice that came through to me in what you were saying there. Just kind of repeat back a little bit of it. The idea of laying the groundwork for a change. So often when we have important changes, there's a rush to move forward, and that progress is necessary. I'm reminded of kind of an old Toyota expression. If you've heard it, or I'm curious your thoughts and reflections on it, go slow to go fast. The point is not going slow, but doing things that at a moment seem slower, engaging people, listening, drawing in more input, building coalitions that allows you to go fast. And I think in my experience then to be more effective and have that change be accepted.
I think that's well said. And I would say that a couple of instances, I think that there's the lean equation or an equation on, the effectiveness of a decision, is what you're really trying to get at. Its impact is equal to the quality of the decision times the acceptance of that decision.
Yeah.
And I see that play out every day. You've got to listen to stakeholders. Their input matters, and that matters whether you're trying to stabilize the individual insurance market in Virginia. When you think about different choices, that really plays out in distribution of personal protective equipment and our testing strategy and any number of things. That if you really got to make sure you listen and understand the problem. And there's one particular instance in our efforts to improve and the governor's initiative to eliminate race, ethnicity inequities and maternal outcomes as a critically important example in Virginia. And Virginia is no different than most states, but there is a significant gap. And there's a number of reasons in terms of access to care, the welcoming or not welcoming and implicit bias of our healthcare system, and a number of access to home visiting and a number of services, multi-generational care, a number of things that we're looking to improve that and eliminate that inequity. But we started with listening sessions, going around the state, working with both providers and patient advocates, community leaders, to listen. Hey, what are you experiencing? Tell me your lived experience, your story, and make sure whatever solutions that we devise are grounded in that experience. And I think that's a critically important principle that is both out of the lean literature, but also understanding how to influence and improve multi-stakeholder situations where they're complex. The solution is not entirely clear, and you need everyone's buy-in. And the best way to make sure you have everyone's buy-in is to truly listen, ask open-ended questions, and not presume that you know the answer before you've really done that type of listening.
Sure. So thinking back, you kind of touch on problem solving and the complexity and the challenge that can come with that. Thinking back to your time in the private healthcare sector, what did you learn about problem solving from the lean practices? What were some of the mindset changes that you experienced from learning and practicing this approach to problem solving and improvement?
Well, I think a number come, and I think that the first aspect of that I noticed, I do remember once we were implementing huddle boards across the organization, and when leaders would round, you'd go to the huddle board to see what are the initiatives that are being addressed, what are the problems that are being solved, what impact do those problems have on the safety and quality of the care that's provided, but also on the professional fulfillment and safety of your workforce. And I do remember we were working on reduction in bloodstream infections and catheter-induced urinary tract infections, that we were asking questions and looking at the data and asking about particular ideas. And I do remember it was like a light went off, and actually it went off for us as leaders as well, when a very experienced informal leader in this case, an ICU nurse said, "Oh, you're not quizzing us about our knowledge of what causes infections. You're asking us in our environment, in the care that we provide every day, what do we think will be most effective?" And then she followed that up with 2 or 3 great ideas that, frankly, we'd never asked her in that particular way. So I think that will always remain as one of those watershed moments where it pointed towards a brighter future, but it also pointed to the past where leaders coming on the unit were to be perceived as maybe lack of safety, or they were there to, you could only get in trouble, as opposed to a great opportunity to share some ideas and to get the leaders to understand that environment better so that he or she could support that better. So that's one of the things that comes to mind.
Okay, good. Well, thank you for that. And one final question and topic, bringing it back more to current day and this past year. What have you learned about managing during uncertain times with COVID and other societal challenges that we're facing? What have you learned about leading in this day and age?
Well, I'm still learning. I'm still learning that, but I will simply say, don't underestimate the impact of dealing with so much uncertainty for an extended period of time. And I think that many of us who were trying to do a good job, trying to lead well, trying to support the response here in Virginia and to give the governor the best options and then to implement those policy decisions. I think leaders and frontline staff, we got more fatigued because this was not a hurricane that was going to turn around in 2 weeks, or at least the weather would get better and you'd have a chance to say time out and move into the recovery phase. This is ongoing and affects every aspect of life. So I think the first thing that I've learned is that when it is such a long-term problem, you've got to pace yourself. And the second thing is, I've learned that you really got to lean on others, because I, as Secretary of Health and Human Resources here in Virginia, certainly didn't have all the answers. And being a top-down command and control leader in that environment, or adopting that type of style in order to feel more in control or safe for myself, would have been deleterious. And I think as the more uncertain an environment, the longer it lasts, the more important that you're drawing on the skill sets of everyone. And the best way to do that is to make sure that you're using those lean principles of the leaders are all about empowering and unleashing the knowledge and effectiveness of the front line. So I would say for me that I think that again, that uncertain, the more uncertain things are, the more you've got to draw on the 8.5 million problem solvers in Virginia, which means all the residents of Virginia, the people of Virginia, and whether they're in the private sector or in the public sector, in leadership positions, or at a community forum where now it's online, or in a Zoom event like this, that you've got to be looking for good ideas from everyone and stay humble and understand that whatever you think is the right answer or the right approach, it may change because of the perspectives of others. So those are two things that come to mind.
Well, great. And I think that's really interesting and insightful on your part, this idea of, if you will, doubling down on that engagement and input and involvement. I've seen, some organizations have continued down that path of, with lean and continuous improvement, of engaging people, working collaboratively and iterating, as I think you were saying. Things are constantly changing, so we're not going to come up with a single magic perfect solution. We've got to keep learning and keep evolving. And there are some organizations where I've talked to people where it seems like leaders unfortunately have kind of we don't have time for engagement, and they go back into kind of command center mode. We have the answers. We're going to tell you what to do. And I appreciate you sharing lessons about an alternative.
Yeah.
Continuing.
I mean, it does. And I would say it does mean sometimes in medicine we used to say if there's an arterial bleeder, you've got to tie that off right away. But then you take 2 breaths and say, where are we? Where do we need to go next? What are the ideas around us? And I think the equivalent in this is that, yes, there were some true emergencies that had to be addressed, but those are relatively small compared to the opportunities where, again, drawing on the knowledge of many really led and is leading to better solutions.
Maybe one last thing I'll ask you. You mentioned your Air Force service, and thank you for that. I have no military experience myself, but I've learned from some retired military medicine people the idea that, like you were saying, there's a time and a place for command and control, life or death, urgent moments. But most of time, even in military medicine, is not like that. So I've learned from some of those former military medicine leaders of their own practice of engaging others in problem solving and improvement, that we do have the time for that, and it does matter.
And I would say our governor, Governor Northam, has really set that model. He is a physician. He was a military physician and cared for wounded soldiers coming back from the first Iraq War in Germany. And he has demonstrated that humility and that openness to ideas. And I think that, again, he's taken decisive action when that has been needed. But even then, it's with the input of many. And again, looking for that iterative approach. Well, okay, that's what we did. Is it working? Do we need to modify it? How can we adjust it to be even more effective? So I do think that those are excellent points that you made.
Well, thank you for making them yourself and for bringing up these important lessons. So our guest again, to wrap things up, has been Dr. Daniel Carey. He's the Secretary of Health and Human Resources for the Commonwealth of Virginia. Thank you so much for taking time and for being here today.
It's been my pleasure. Thank you for this opportunity.